We're going to be starting to do force adjustments today on Kendall. She's had her fourth therapy today, and she's been wearing her orthotic every night for the last 2.5 to 3 weeks. And now that she's been wearing her orthotic every night and she's had 4 therapies, now we can begin the process of starting to gradually bring her dental forces into alignment. As she does her rehabilitation therapy, her muscles will gradually adjust and get better, and her joints will gradually adjust and get better, and we're going to also gradually and improve the forces on her bite as she goes through her 8 to 12 week process of rehabilitation therapy. With regard to her TScan, we're going to use 3 single bite scans in order to make these adjustments. The first single bite scan will be a close, hard, and hold and open. The second is the left lateral, close, hard, and hold, slide your jaw to the side and open. And the third is the right lateral, close, hard, and hold, slide your jaw to the other side and open. These 3 scans are the ones that we'll use routinely as we make occlusal adjustments. And we usually don't go back and do a habitual force multi-bite scan unless we get to the end of treatment and we want to redo another comprehensive scan for the patient. These first adjustments are called phase 1 adjustments. The phase 1 adjustments represent any interferences to closure that might be getting in the way of the patient bringing their teeth all the way together as quickly as possible. Those adjustments are primarily done between the A point and the B point on the graph, which means anywhere from 0% force up to about 85% force. The actual position of the B line on the scan is usually somewhere around the time that the red and green lines level out and create a stable full closure. Sometimes that B line will be a little bit farther to the left or a little bit farther to the right. We just want to make sure that wherever it's positioned, it's at the point where the red and green lines stabilize. That usually will be at about 75 to 80% of total force. If I put my cursor on the B line, right beside it, we're at 79% total force, so about 80%, which is where we expect the B line to be, and certainly it's a good position because the left and right levels are stabilizing. So from B to C on the graph is when you're closed together fully on your centric stops. From A to B is trying to get your jaw into your centric stops. So I call this parking the car in the garage. I would like to just be able to pull my car into the garage and stop. And I want to be able to close my teeth as quickly as possible and as bilaterally as possible without anything getting in the way. So if I open the garage door and I go to park my car in the garage and there's a little skateboard sitting on the garage floor, I have 2 options. I can either swerve around it, which means I'm going to be using extra muscles in order to get my teeth together, or I can just run over the skateboard, which means I'm going to be crushing the tooth that's in the way. So whether we decide to avoid or destroy any interferences between A and B, what we call force outliers, those force outliers that are in the way of closure create a dysfunctional chewing pattern. By eliminating those little skateboards, those little interferences to closure, we can shorten how much time it takes to get the teeth together, and we can reduce the amount of muscle activity necessary to get the teeth all the way together. So in our analysis of this, from A point to B point, generally that amount of time should take less than 0.2 of a second. We don't have to measure that on the time graph, although we could go in and look at this. But we can just go up to our timing table up here on the right, and we can see that to go from A to B takes us 0.11 seconds. 0.11 seconds is certainly plenty fast, and as long as everything's coming together evenly and normally, we would be okay with that. If, however, this is fast, but our kite is outside the target zone, then we still have some work to do so that our early force contacts are not outside the target. And we want to keep our kite tail as short as possible. So when we make our initial adjustments, what we call our closure adjustments or our occlusion time adjustments, what I often just refer to as A-B adjustments, those A-B adjustments just help us to park quickly in the garage, reduce muscle activity, and shorten our little kite tail, and that's all we're looking for. On Kindle, I could say that this is fast enough, but we also know that on her kite tail is too long, so I would like to shorten her kite tail just a little bit and make a few little minor adjustments from A to B. In other words, she's got a little skateboard on the garage floor. It's nothing too major, but I don't want to be driving around it or over it. So I think we're just going to see if we can eliminate that skateboard from the equation. If we can do that, she's going to easily be able to get her teeth together quickly, short kite tail with reduced muscle activity. And then after we get the car parked in the garage, we can make a decision about how well it's parked. For right now, we're just talking about driving in, just closing the jaw, what we sometimes refer to as an unhindered path to closure. My first adjustments are always done between A and B. The way we find where we're going to make those adjustments is by going up here and selecting force outliers from our timing table, from our timing graph. We select force outliers. When we do that, the teeth that hit earliest and with the most force show up on this table, and we can see what time they show up, and in this particular case, they show up in order. So her highest force early contacts or early forces are on tooth number 14, 15, 3, and then 2, in that order. So 14, 15, 3, 2. So I have 4 little skateboards that we're going to be working on to see if we can shorten up this kite tail a little bit and bring her teeth together more smoothly and quickly. So if I'm going to be looking at tooth number 14, 15, 3, and 2, how do I find the location of those forces on the teeth? I'm certainly going to use articulating ribbon. I generally use 40 micron articulating tape to find these force outliers. And the way I like to do that is by grabbing my 3-dimensional graph over here, which is the most accurate data on the page. And I tilt this down until I'm looking right straight down on tooth number 14 and tooth number 15. And as I look down on tooth number 14 and 15, I can find the earliest high force contacts that are there. So that's where I'm going to take my a gander at what I'm going to be looking at. Here I can see that I'm looking at a yellow spike here, a pink spike here, and we'll be looking for those. We know that this happens at 0.03 and 0.04 seconds on our timing. So just for fun, let's look at our timing table. I'm going to take my B line. I'm going to move it back to 0.3 seconds. So right now I'm at 0.013. So I'm going to gradually click forward. until I get to 0.3 seconds. Here we are at 0.03 seconds, and and you can see that everything looks pretty even up until that point at 0.3. As soon as I go forward to 0.04, then we start to see those force outliers showing up on the three-dimensional graph over here. Now, those are the outliers I'm going to be looking for. On this particular graph, they're both aqua in color, or green. I'll tip the three-dimensional graph down, and I will orient it so that I can look right straight down on those green outliers. And I can see that the one on tooth number 15 is on the distal facial of 15, and the one on tooth number 14 is pretty much right in the middle of the functional cusps on tooth number 14. So this is where I'm going to be looking, is on tooth number 14, tooth number 15. If I wanted to look at the comparison between the upper and lower arch, I can switch my view on the screen, and I can look at both arches, upper and lower, simultaneously. I can tip the lower one down, and I can see where those same two high force areas are, only I can look at them on the lower teeth instead of on the upper teeth. And as we do that, we're going to be looking at tooth number 15 or 18 and tooth number 19. So once again, tooth number 18 on the distal facial, tooth number 19 more toward the lingual, which is going to indicate I'll probably be working on a lingual cusp on the upper tooth and maybe the distal facial aspect of the lower left molar. So let's make those initial adjustments, and then we'll make a couple of adjustments. Usually we take one scan, make 2 or 3 adjustments, come back, make another scan, make 2 or 3 adjustments, and that's all we would do on the very first occlusal adjustment appointment for Kendall. So this is phase 1 adjustments, visit 4 on her, and if this goes well, we might move right into phase 2 adjustments, because certainly her timing is very short. It should be very easy for us to go from phase 1 adjustments to phase 2. Thank you. Back teeth, chomp up and down, hold tightly, hold, open. Okay, so now there's a lot of blue marks on this tooth. The question is, which one is the one that's not right? Right? And so we know it's kind of on the distal, and there are areas where we would not expect to see contact on the distal. And if I look on the distal of this upper tooth up here, I can see the slope on that. I can see the slope on that distal lingual cusp, and I'm going to make a small adjustment here. So you turn away from the distal. Thank you. Slightly open. Close, hard, and hold. Open.
It already feels different.
Oh, wow. Big difference.
Wow.
So look how much closer she is in the target here.
Yeah.
Okay. So let's go back.
So short.
Go back. A little more force outliers here. Now it takes you longer to get together because now you have to learn all these other things you got to work around. So now we're looking at 14, 3, 2. So let's take a look at 14 again. So 19. Take that. Take a look at 8. Close together. Chomp hard. Open wide. Chomp hard. Wide. Chomp. Open. Okay. You doing okay? So, chomp, chomp hard, chomp, chomp, chomp. Open. Good. That's better. That's better. $30, $31. Open. Close. Chomp hard. Again, chomp, chomp, chomp. Open. How is chipping on this?
Mm-hmm.
Let's smooth those rough areas down. Really, we're chipping a lot of the off down here.
Nice.
I'll put this on our calendar to 30.
Mm-hmm.
And off the lingual, just a lingual test for 39. So, chomp, chomp, chomp. Open. What are you seeing? Push anything? So open. Then let's rest. Slightly open. Close, hard, and hold. Open. That's better. This. Wow. Okay, tail shorter, right? Starts out in the target and then ends up with force on 2 and 3. So if I go back here, I'm just going to take a look and click through and see what happens. I can see this coming up. If I do it here, look at force outliers. And 15, 3, 2, so 15 still early. But 3 and 2, and then we'll just, so that's at 0.0506 seconds. So I'm at 0.06 here, so we should be able, that's about what I'm looking at. Same areas. We'll just lighten those back up a little bit more. Can you tell the difference?
Yes.
Yeah.
I'm definitely hitting more going it this way for sure. On my left.
Yeah. So, you know, this is one of the things I should be talking about. But this is what we hear a lot, is that patients will say, oh, now I'm hitting up here. Okay. Well, her forces are still 20-25% on her molars, but because she hasn't felt these for a while, now they start showing up, now she's feeling them. If I just went based on what she was feeling, I'd be adjusting on the wrong teeth.
Right.
So 15, 2, and 3. Okay. That little thing. That little thing. That's right here, huh? Close hard and hold. What do you think? Okay. AB line now is at 0.12, about the same. Kite tail, a little bit closer up. Still have a little bit of force here. Let's look in here. 16, 18, 22, 15 still. Okay, now, I would be done.
Yeah.
All right?
Right.
You feel a difference. I feel a difference. We'd be sitting on your orthotic and doing another therapy before we do much more.
Right.
Your left and right balance is pretty good right now. Everything's pretty stable. I got a great looking graph. I would probably, once I see a good looking graph like this, and I'm still at 0.12, 0.11, let's click on force outliers here. I probably still have, it's probably still the same spot. But we need to let your, yeah, but these are a lot different now than they were, so let's mark 15 one more time. Open up. Close hard and hold. Open. That's a big change.
Yeah.
So that's good.
Refill.
Yeah, let me have some tape again here.
Can you get me one?
Close all the way together. Trump card open. Open. Close. Open. Close. Open. Close. Close together, slide to the left, and slide now close, slide to the other left. Awesome. Close, slide to the left, open, Now, do you want a picture of how I really do this? Will you look in the drawer, one of those 2 drawers or 3 drawers, see if there's an obfuscate in the package? Do you know what I mean?
Mm-hmm. I know what you mean. We roll.
Oh.
It's kind of a small one, but that's okay. Let's see if we can make it. Soft. So you tuck this under your lip in front. Under your lip on the top. Fold your lip out over it. See, it's too small.
Good go.
Okay, close. Make your lips really soft. See if we can put this in there. Okay, now don't open too wide. Alright, let's have a 2x2.
New profile.
Okay, you got this on, Scott, video?
Yes.
Okay, open. Okay. Yes. What color is that?
You're A2.
Jeez.
I wonder if they have any.
White?
You don't want an A2 on there? They have some. Oh, look at that.
Close together. Hold that just back to you. Just gently.
I just realized this had a built-in digital level,
Oh, does it?
so that tells me what level. Too bad I've had this how many years and didn't realize that's what that thing was for.
Oh, man.
I haven't seen purple etch before. Ours is blue or yellow or crowns.
Mm-hmm.
Yours?
Okay.
Oh, me. Okay. You have a picture of that, Scott?
Sure.
How many teeth did you add on to?
2.
2.
And up.
Just may not, so we'll see how it goes. It might pop out once the colors are going out once it comes. Plumbing agent. Plumbing agent.
Which do you
Oh, I'm going to put the, I'm going to use that T with the, Angel, could you get the CR syringe, the composite syringe out of the one over here?
So which one are you wanting to use?
The
C?
no, the,
There's a T. Is it T? You want the T? You want the translucent? This is the one I had in my
well,
hand.
didn't we have one of the, what's that bleach shade?
It's a bleach.
This one right here. Don't be tapping your
Let's use
foot,
that
Dr.
one.
Porter.
That one. I'm not,
Hear me?
I'm not.
I heard you.
No, I'm just adjusting.
Now, is this bond of 10, 5, 10? What do you do on this one?
10.
Okay. I think it's at 10.
Wait very gently in your back teeth. Close all the way together in your back teeth where you normally fit. Close and hold. Cure. And this.
Yes.
You did. It's okay.
Alright.
Okay, I'm okay with that. Open. Oh no. Close.
No.
Open.
Kendall, it's okay. It's okay.
Okay, good. 10 more on that side, 10 more on this side.
Funny.
Stuck together then. Okay.
Let's get together. Tap together. What?
I like it.
You're hitting hard on that,
Not
right?
hard, I'm just hitting on it. I haven't felt that
Do you want it in here? Or do you?
Yeah.
forever.
Close together.
When you're not
Slide
used to
your jaw to the
getting
right and open. Close together. Slide your jaw to the left and open. Okay. Close. Slide to the right. Close. Yeah, hold it there. Back to the middle. Open. Slurpee.
Yeah.
Thank you. All right, now we're going to take a look at her left and right laterals. Close hard and hold. Slide to the side and open. Close hard and hold. Slide to the other side. And open. Oof. That's going to feel weird. Close together. All right, let's take a look. It's a lot better there. Get the other one. But she's not even going to be able to feel this for a while. You can put grass in there, or what's the deal? She's just resting?
She's just chilling out.
Huh?
But she feels so good.
Still won't move?
I think she's in office now. The button. She said she doesn't hurt anymore at all. Oh, that's so good.